Hello, and my name is Rendon, and today we're going to discuss CPR, coronary pulmonary resuscitation. So, just a little bit about myself. I've been doing this for the last 15 years. I am certified through Medic First and have been certified for the last 10 years. So 5 years was more of a student. So, a little bit about this. The first thing you want to look at is you want to look at your own personal safety. Okay? So before you enter into a situation where you're dealing with a coronary pulmonary resuscitation situation, you want to stop. You want to check your environment. So what you're looking for any known hazards, anything that you can see that would be a hazard to yourself or a hazard to the person that you're dealing with. You also want to do what I like to refer to as jazz hands. So you want to put on a set of gloves, okay, for your own personal protective equipment, or otherwise known as PPE. So you would don your gloves, making sure that they had no holes and that there were no breaks in the gloves. At this point, you would want to enter the area after you know that the area is safe. You've checked your area, you've got your personal protective equipment, and now you can enter. What you want to do is you want to introduce yourself to the patient or the person that's having the situation. You want to tap them on the shoulder, and you want to say, "Hey, my name is Ramiro, can I help you?" You would, of course, use your own name. "Hey, can I help you?" This helps us in two reasons. For one, it checks to see how conscious the person is. And for two, it also introduces us and asks us for permission to help the person. At any time, any person can refuse to allow you to help them. So, in the state of Texas, under the good faith, we would say, "Can I help you?" No response. Then the legal term of implied consent would come into place. Now, implied consent basically means that under any normal circumstance, this person would allow you to help them. So in this case, we've tapped the person on the shoulder. They have not responded to us. The legal term of implied consent comes into play. So, now we have to do a 10-second to 5-second assessment. This assessment we are looking for is for normal breathing. Normal breathing would be categorized as the steady rise and fall of the chest, just as if you were to be sitting in a chair on a normal, relaxed day. That steady rise and fall of the chest would be considered normal breathing. Anything other than normal breathing would be considered abnormal when it would cause us to start our process of CPR. So, if we come to the person and they're snorting, they're gurgling, or they're making a wisping sound, that would not be considered normal breathing, which would allow us to start our CPR process. We would then station ourselves with the person on the ground, on their back, head facing upwards, with our knees as close to the person as possible, bending at the waist at a 45-degree angle, with our arms extended and our elbows locked. Left hand over right or right hand over left would be the preference of the person doing the CPR. You would integrate the hands as such, take it to the center of the chest and between the nipples, and you would start compressions. Now your compressions under the American Heart Association would be considered to be fast and deep. For the purposes of this, we want to do a compression that is at least 2.5 inches deep at 30 compressions at 100 beats per minute. So 100 beats per minute is pretty much 1, 2, 3, 4, 5, 6, 7, 8, 9, 10 would be the speed that we would move at. Taking our hands, one or the over the person at a 45-degree angle, bent at the knees, close as you can, using your upper body weight to push down to get yourself 2.5 inches into the chest, allowing the heart to actually compress itself and release itself through the pressure that you're causing from the chest cavity. You would do 30 compressions, and then you would move into what we call rescue breathing. Now, in order to get rescue breathing, what we would need is to do the head tilt chin lift. And it's exactly what it sounds like. You would take your hand, putting it on the top of the head, on the forehead, use 2 fingers underneath the chin, in this area in the hard piece, not the soft, and you would push back on the head while lifting up on the chin. Okay? Releasing the bottom portion of the chin, and then adding a one-way valve mask to the face, allowing you to safely give a rescue breath without coming in contact with bodily fluids. Now, how we want to do the rescue breaths is one breath, 1 second in length, with enough force to visibly rise the chest. We want to do that twice. So once we've got to the portion of the head tilt chin lift, and we've opened up that airway, we want to add that mask, and we want to take that rescue breath. Once we've seen that we've forced enough air into the body that it causes a visible rise in the chest, that would be considered one, to be not more than 1 second in length. Okay? Then what we would do is we would repeat the process of 30 compressions, 2 rescue breaths, 30 compressions. We would repeat this until we had another service provider. Now, in conclusion, I would like to talk about CPR being done and being trained by professionals. It is best for everyone if you seek out your local American Red Cross, Heart Association, or hospital for your proper CPR training. Thank you. That is my presentation.